Hi, welcome to this episode. I've wondered about something. I don't think people trust doctors so much.
Especially in this climate.
Not even only in this climate. Like, there are a number of people that don't trust doctors. They just feel that if a doctor is telling you something, there's an hidden reason why that doctor is telling you that. So why do you think? Don't you think
There are
so?
so many
Yeah,
reasons. There are so many reasons. Okay, I may not be able to
You do
exhaust them.
trust your doctor? Okay, yes. The person
Well.
is saying yes. They are saying yes, but the person is saying, but not all. I don't trust
Okay,
all
all
doctors.
doctors, definitely.
I know.
I'm going to try and analyze some reasons too. Let's start from age, the age of the doctor, young versus more elderly doctors. So if a younger doctor is saying something, may not be convincing by virtue of age. People tend to trust male doctors more than female ones. Take it.
Well, maybe in this environment.
In this environment, everywhere.
Everywhere.
Mm-hmm.
Why would you trust?
There may be some gender bias. Yes, gender bias.
Gender bias.
I'm serious.
And to be male that they will trust more than females.
I'm telling you, there's this general belief. Okay, if you're saying a female, it's a nurse. The other one is a male, it's a doctor. Let's leave that. Let's go to the next point. Other reasons, they feel that they generally, this person is human. How am I sure that this person even knows truly what they are talking about? Am I sure that this thing is not being cooked up? Also, they may feel that there's a profit or a benefit undertone in what the doctor is profiling, or maybe they are just profiling that solution based on convenience, based on what the doctor wants to gain and all that. One other reason I must not forget, people usually tend to trust foreign trained doctors more than locally trained doctors. Foreign trained, let me give you an example. I remember there's this doctor that used to say, I'm a so put one foreign trained doctor as hype.
Yeah.
I don't want to mention the name of the country, but she used to use that as a hype. And I'm looking at it like, and so, but generally, if you mention one foreign place that you trained there,
in Russia, Moscow.
I don't know.
This one has experienced Putin.
Yeah, so the person must be a good doctor. Not necessarily, so it's just hype.
Yeah, so, but my own perspective of why people don't trust doctors, I think they don't trust doctors because many times doctors tell the truth. Do you like the truth? People don't like the truth. You want to meet somebody who is going to tell you what you want to hear.
Exactly.
And you want someone who is going to tell you something certainly. Doctors usually don't tell you.
Yeah, I like that. Yes, they like you to be very certain about what we are not good.
In fact, many times people say what we don't say out of certainty. For example, you say the doctor said the doctor said he's going to die after 2 weeks. There's no doctor that says you are going to die in 2 weeks. I have not seen any doctor in Nigeria that will tell you are going to die in 2 weeks. So
it's true, and people say that.
There was a joke or a comedy, a little skit I watched where somebody said the doctor said he had 7 days to live. He had 7 days to live, so he was counting down the days. He was telling his wife that it's just 6 days left now. So let's make sure you do this. It's just 5 days left, so make sure you do this for me.
Mine is not like you are the one holding the life of that person.
People don't even die like that. When doctors give time span for maybe people to die, you will see the person depreciate gradually. It's not like a prophecy.
Exactly.
That he said if you go on that journey there will be an accident. No, it doesn't happen like that. So because doctors don't say things certainly. If you have twins and you're asking the doctor, will I be able to give birth to these twins by myself? The doctor says you may be able to, but you may not be able to if the leading twin is not in this position. If the cord becomes like this, so they don't want to hear that. They just want to hear that,
you will be able to.
yeah, you will surely deliver, which is what all these traditional guys do. You go to a traditional guy and he tells you that, forget it.
Abacadabra.
Forget it. This thing is
certain.
Certain. Learn
A
that.
doctor cannot do that.
Doctors don't do that. We tell you pros and cons. We tell you about possibilities. We tell you about probabilities. And we try to make sure that we make things to align with the positive probabilities.
Exactly.
So don't come to the doctor and the doctor gives you an anti-malarial and you tell the doctor that, doctor, once I take this anti-malaria, are you certain that this malaria will never disturb me again? The doctor will say no. That's not what I said. Let's try this drug. Let's use this drug. This drug works in most people.
Yeah.
And I expect it to work for you. But if it doesn't work, we have another line of therapies that we're going to use.
Let me give another example in that line of your thoughts. So someone wants, like a surgeon that he wants to perform a surgery, and someone says, hope I will not develop this complication. You can't say for a certain that patient will not develop that complication. You can only say, well, I'm a good surgeon, I have these years of experience, and I've done this case several times, and out of the cases that I've done, I've not had this complication. But what if you're an exception? We don't pray that you are going to be an exception, but that surgeon cannot tell you for a certain that you will not develop that complication. But it would assure you that I've been doing this for a while and I've not had this complication, or I've had few complications.
So that's the difference between us and some of these other people that
when you go to a spiritualist or something like that,
they'll say no, forget it is done. I've seen patient, we were discussing gunshot injuries the other day. I've found there are people who have gunshot injuries. They go to the traditional guys and they will tell you, those bullets, we are going to call them out. We are going to and the patients will come and meet you and say, you see the bullets that came out. You see the ones that came out. Medicine is not like that, which is why medicine.
Well, we are not using metaphysical forces to
just
treat.
Tell you the way it is. So don't say I don't trust those doctors, because
they are not going to. They can't say for a certain.
Doctors are just like human beings.
We are human beings.
It means that the same way you can have some errors in other aspects of life, the same way you can have people who have evil intentions in other areas of life, it's the same way you can have those people practicing medicine. It doesn't mean that medicine as a practice itself has those problems.
Exactly.
Medicine as a practice is supposed to be very plain. We try to be as ethical as possible. As a matter of fact, every day we try and refine the ways we do things to make them better. Something
just came to my mind now. One other reason why sometimes it looks like, say, this doctor said this, that one said that. Now, how do I explain this to us? There are different routes. There can be different routes to achieving something. And doesn't mean that those opinions are wrong. So two doctors, the same case, may have different routes of doing their thing, but the underlying principles are the same. But they may have different routes, different opinion, but the common goal is the same.
Yes, usually when that happens, it might just be because one doctor has told you one, the other doctor has told you the other. If you ask one of those doctors that this other doctor said this, that doctor would likely be able to explain why that was said. Sometimes somebody may be more experienced and you say, yes, I understand why he said that, but I'm
choosing this,
That's the way to go. Summary: find a doctor that you can trust.
And that's why we family physicians are there.
They
were supposed to help you put everything together, nicely. We are the springboard of the healthcare so that we can manage you properly. We are not saying we manage everything. No, that's not what we're saying. But we are supposed to be able to manage 80% of what is prevalent in our own environment and be at the middle of the spoke shape so that we can link you with other specialties. And then they are supposed to bring you back to us so that we harness and organize everything nicely for you so that you can have a less fragmented care.
All right. If you have comments, let's have them in the comment section. Do you have reasons why you don't trust doctors? Do you have reasons why you think doctors are to be feared?
All right.
Write them in the comments.